In terms of the environment that we want, we now know that the uterus is rich in lactobacillus, which is a fairly dominant organism in our guts as well. And when you're picking up a probiotic from drug food stores, from health food stores, drugstores, wherever you're getting your probiotics, they're mostly lactobacillus with some bifidobacterium, and some others have others in them, but those are kind of the two main strains. So we know that the uterus is highly a lactobacillus-dominant environment, and that is what makes it receptive for implantation. They do find in research that women with a non-lactobacillus-dominant microbiome are more likely to experience implantation failure and miscarriage. So again, it's about the balance of the microbiome. Everyone is going to have other bacteria. There's going to be a little something of other things in there. Streptococcus and Gardnerella is a common one we see, or Portobella. You're going to have a little bit, but the little bit is fine. It's about the overall balance of all of the bacteria. Lactose are important, like we said, for implantation, but also for early pregnancy as well. Implantation itself, it causes a shift in the immune system. And this cannot happen if the endometrium is already inflamed and there's a large amount of inflammatory cytokines already kind of like doing damage, essentially. It causes an even stronger imbalance in that TH1, TH2 shift that we need to see in early pregnancy for implantation. And it keeps the immune system from being able to go back and forth in those early weeks of embryo development that we need to maintain pregnancy. So again, early losses, potentially that inability of the body to shift out of the autoimmune dominant immune response and shift back into the don't attack everything that you see immune response. If we can't do that, then of course the body's going to start attacking the embryo. A low lactobacillus state creates this pro-inflammatory environment. We can all agree that inflammation is not good, right? In the uterus, whether or not we have all the data, we have all the research, we understand it completely, we don't yet. And I think this is a very misunderstood piece of the infertility puzzle, but it also logically makes sense that this is not a conducive environment for making a baby. I am obsessed with Friends. I pretty much watch it every day to help my body wind down. It's my show. It's my comfort show, right? And so I always think about when Monica and Chandler are going through their infertility struggles and they go to the clinic and, you know, they run into Janice and Chandler has to go do his semen analysis. First and foremost, if your husband watches that, know that that's, you know, those creepy rooms are not what it's like anymore. Just go get tested done. You get to do your sample at home, but that's my sidebar for today. And they find out from all their testing, they basically just say that like there is something wrong with Chandler's sperm, but that Monica's uterus is an inhospitable environment.
Apparently my sperm have low motility and you have an inhospitable environment.
Very well could have been this that they uncovered, because that's like probably one of the best ways to describe it. Is it just creates this inhospitable environment from an inflammatory angle, from a immune angle, and all of these pieces are stuff that isn't going to come up on your run-of-the-mill lab work. We do talk about some of this more like advanced maneuver testing, the stuff that we maybe want to look into if you've been told you have unexplained infertility and you've had a bunch of blood work done and, you know, everything looks normal, everything's all good. We do talk about where we go from there inside Fertility Confidence Method, obviously, but also inside Labs 101. It's $17, you guys, ttc.kelseyduncan.com/fertility-labs. Actually, is there a dash? I don't know. I'll put it in the show notes, but I highly recommend going and checking that out if you're like, what labs do I need to do to understand if this is maybe something I need to investigate? The other piece with lactobacillus is it's also actually really important for breaking down the endometrial layer to assist with implantation. So something that I never really considered is actually the act of implantation. You know, it's not just this like sticky little thing that is just there. It needs to burrow in to the endometrial layer, similar where the sperm needs to actually burrow into the egg, that acrosomal reaction to break down the outer layers of the egg so that the sperm can get in and fertilize. That's a very important step, as now we have this embryo moving in, binding to the lining, we need that lining to be able to let that embryo actually in and implant. And so the lactobacillus environment, it promotes proper prostaglandin production, which is actually an inflammatory cytokine. Some inflammation is good, guys. We don't want to get rid of all of our inflammation because there's inflammatory processes through the menstrual cycle and through fertility that we need to happen. It's again all about proper balance.